The Mihealth project came about through my own diagnosis of breast cancer and the difficulties my family and I had in trying to find information. And I was able to use my personal experience and my experiences of working with new media to be able to work with the team to create a system that we think will be able to support patients by providing them with personalised information that's about their own diagnosis rather than all the information about breast cancer. The information that the patient accesses through the system is text-based. It's 2D and 3D imagery and also video content of patients' past experience. There's also support applications that we've included, which are a diary and a treatment profile to enable patients to keep track of their treatments and medications, a glossary and a search facility, and also a small package that enables patients to keep track of their mental and physical well-being on a daily basis.
We went up to the Linda McCartney Centre and we distributed the website to 20 users who had unlimited access and from a wide sort of age range. And then after 3 to 6 months of having the system, we followed them up and asked them what their experiences had been and how they'd been using it and where it fit into their relationships and how it affected how they related to doctors and that sort of question. From our perspective, one of the great things about Mihealth is it takes a set of things which everyone does, kind of common sense ways of finding information and using information, and puts it into a resource for people to use. We think that model, that underlying model, could be of potentially great significance to patients across the board suffering from chronic conditions, because it allows them something which is a bit of a map, a support guide in ways which they don't get from medical practitioners as things currently stand, who are there to deliver the very decisive information. This is the kind of practical stuff which patients face on a day-to-day basis, and for that reason I think it could be of tremendous use to patients with a range of chronic conditions.
The benefits to patients from using the Mihealth system, as far as we can tell through the pilots that we've done, are that providing information that's about the local environment that they're receiving their health care, so their health clinicians, local support services, and even basic information about how to car park at the hospital are proving to be really useful. And because the information is about their own diagnosis and is delivered in stages, that it supports their needs in terms of not everybody wants all the information all the time, and that people do want it in stages.
In my dealings with breast cancer patients, and also as being involved with a breast cancer charity and the National Programme for Information Technology for Breast Cancer, what we've discovered is that most of the time what the patients want is information. They want support, they want you to be sympathetic to the problem that they have, but basically what they want is information. They want to know what's going to happen to them, they want to know when it's going to happen, they want to know what kind of effects the treatment's going to have. And so I see Mihealth as being a personalised system to give that information to the patient when they need it. One of the things that patients need is some way of going back to the information again and again so that they can actually be absolutely sure of what they're dealing with.
In the future, we hope to be able to develop interfaces for interactive TV, mobile phones and PlayStation so that we can provide access in and out of the hospital environment to as many people as possible. We've also set up a company to be able to implement Mihealth on a much wider scale and are working with the NHS to try and make that happen.